My name is Valerie Bell, and I'm your classmate inside Nursing 434. I just wanted to talk to you a little bit, maybe briefly, about 3 to 4 minutes about medication errors that occur in the hospital, as well as other errors that we as healthcare providers can help to prevent. One of the main errors that happens in the hospital with the nursing staff is medication errors. These errors can be prevented with proper intervention, as far as identifying the patient, making sure you have the right medication, the right dose, the right time, the right route, etc. The 5 rights, of course, we all know. Medication reconciliation is one of those things that help us to prevent those errors, not as far as administration, but making sure that the patient has the right medication they were previously taken when they were at home. This way, if they were on a medication at home and a doctor prescribed something in the hospital that may conflict with that medication, it can be caught and not become an adverse reaction and potentially harm the patient. Medication reconciliation is a JACO requirement and is required by all healthcare facilities, and JACO is keeping a tab on this. Medication reconciliation starts in the emergency room if the patient comes to the emergency room, and also when the patient is admitted to the hospital, JACO requires that a medication reconciliation be done. On the unit that I currently work on, we have to do medication reconciliation on admission, making sure that the patient is on the right medication, the right dosage, and so forth and so on that they were on when they were previously home. A lot of times when patients come into the facility, they don't have that list of medications, but we as nurses, we have to make sure we explain this to the patient that we need a list of medications that they were previously on, and a lot of times they'll have their family member come in and bring the medications that they were previously on in the hospital. So we see that medication reconciliation is very important because of the fact that we don't want any patient getting any medication that can conflict with another. And if you don't know what the patient was on at home, this can be easily done. So as I stated before, medication reconciliation is very important and it is a requirement of JACO. So we will continue with the 5 rights, of course: right patient, right dose, right time, right route, right medication, but also making sure that the patient has the medication reconciliation in the computer system if your hospital uses computers, or on file on the paper chart if your hospital is still using the paper charts. Thank you.